I feel like I was more apt to introduce myself to others, which like at was like not was not like me.
The old Mike would have kind of like if I stuttered in front of a group of people, I would probably like, for the next a day or so or like hour, whatever it is, kind of be just be thinking about it, like, oh man, that was embarrassing. And now if I stutter, like I pretty much don't think about it at all. So yeah, it's been a great change.
When I got into grad school, it was almost like a redo, and I would just introduce myself, and immediately I was like, I would advocate. I was like, and S words like my name, of course, are hard for me because I have a stutter, and so like that right off the bat was awesome, because like everybody's reactions were I was like, oh, okay, like, and I was like, oh, this is great.
I really loved like when my therapist started with, as I'm a medical student, I know somewhat about the environmental factors, the genetics. So my therapist went ahead and explained all the knowns and the unknowns of stuttering, and it helped me a lot. I could think back and yeah, it makes sense why my stutter is fluctuating back and forth.
It's just more about like me being me, and like not hiding like as much as I used to.
Like I said before, this was about the first time that she would acknowledge it to other people and ask for their patience, and and that's a huge step.
Last year when I went back home after a few of my therapies, when I had learned not to hide it anymore, a few of my friends were surprised to see me stutter, and they were like, hey, what happened in the US? Why are you stuttering? I was like, I have always been stuttering, and I was just really good at hiding it. But now I go in, I'm not saying I don't stutter at all, but when I do, I do it in a way that does not make the patient uneasy. And with more experience, I'm learning more ways to sort of not hide my stutter, but put it out. And I have seen like when the patients, they see like the vulnerability in medical students or the future doctors, they usually open up more. This just helps in between the communication between the patient and the doctor, where they think like, yeah, he is vulnerable, he's open about it with me, so I can be vulnerable too.
Yeah, I was much more, I would say, confident after my perspective had changed. But beforehand, I wasn't necessarily like a quiet guy, like, but there would be instances where I would, not speak up in like a group of people or something like that. And then after my perspective changed, it kind of just, I pretty much stopped worrying about it, which was really something I've been seeking my whole life, which I didn't even know that I was seeking for it. So it was a huge help in just the perspective change on my entire social interactions.
It was overall a very positive experience. It really validated a lot of the emotions that we were having as a family and a lot of the difficulties that we were experiencing right then. So that was one of the biggest things for us, is just to not feel alone during this phase and to know there were other families and we can work through this, and to have that validation. Our entire family, I feel like, grew as far as being respectful to each other and giving space for speaking and listening to each other.
I think it was understanding stuttering at a deeper level, at a psychological level even, where it's really, how do they just accept who they are and that they can still speak whether they stutter or not, that they can communicate, and that it's really not something you're going to get over or have a technique to kind of, mitigate the stuttering, and that you can speak in spite of it. So just being able to really understand that and accept stuttering. We're not looking for the answer or the solution for you'll never stutter again. So just learning the psychological aspect and how it impacts children and adolescents, etc.
So going into the training, I had no confidence of what I was supposed to be doing or how to support him. So at the beginning, I was very uncomfortable, very unsure how to help him be successful. And at the end of it, I knew that I really was set up for helping him be as successful as possible. Some of it is just being willing to give time and let people have their time to speak.
I think this is the start of when she was a little more willing to just let people know that she's a person that stutters, to help dial down the pressure that she was feeling. That's maybe the first time we started to see her be willing to do that.
She would actually, at times, she was a little more lighthearted about it, which was nice to see. Her self-confidence just seemed to blossom. That was the main thing, was just her self-confidence and her willingness to talk about it and to be a person that stutters. And she didn't feel embarrassed about it really anymore. Just said, that's just who I am. So
I believe the most important part was to make me realize that stuttering is not something bad. It's just a part of me. I like it or not, it will be there with me, and it's a part of my identity. And the sooner I accept it, the better I will be. During our very first session, the therapist made sure for me to understand that these therapies are not designed to make the stutter go away, because after explaining the genetics and the environmental factors, it will be there with me, but the goal was to get to a level where I feel like I can exist and I can stutter and I will be fine.
The overall experience was just so positive and really led our family from what started as a very difficult phase in our family to a much more successful phase, but also just brought a lot of calm and peace to our family. That just really allowed us to flourish, and allowed our son to build his confidence, build his ability to have friends at school, keep and build the peer interactions.
I was able to grasp concepts better and understand better. It's extremely important to have a therapist with experience. It just makes it all worth it, and you can connect on a deeper level and I feel like I learned a lot more about me as a person as well.
One of the specific things was to really focus on just this whole positive, supportive environment. Something that I did not know was how it was really a neurological component for the children, which is very different than other conditions that I'm used to. It's much more of a support system and support role, and set up this positive environment for him to work within was really just such a change. And that's definitely something that we were not getting from the speech therapists who were not specialized in stuttering. I would encourage asking more questions and really trusting your gut instinct, whether it's seeking that specific therapist who you are working with currently and finding out what their specialty is, or if they know someone who specializes in stuttering.
Yeah, I would definitely, advise them to look for a therapist who is more focused on the acceptance and realizing that it's not a problem, rather than someone who's trying to fix the problem.
I would say they would need to have patients in their practice, or clients, I think is what you guys call it, and that stutter, so that they have experience. And if they don't have the experience and that's all they have access to, someone who's willing to learn and put some time and effort into it, doing some research, look into what is stuttering, how do I treat a child who stutters, and making an effort